Medical care is a unique consumer purchase. Hire a bad plumber or painter, and you could be unhappy with their work, but it won't kill you. The key to getting great medical care is to be careful how you choose the doctors who will take care of you. And that's not easy to do based on the limited data available to patients. I'm Herb Weisbaum, the Consumer Man, a contributing editor at Checkbook.org.
Welcome to Consumerpedia at Checkbook.org. We're the nonprofit that helps consumers select services, avoid trouble, and save money. Because we don't accept any advertising or take money from any business we recommend, you can rely on Checkbook.org to be completely independent and objective. Now, here's the host of Consumerpedia, America's consumer expert, the Consumer Man, Herb Weisbaum.
Physicians are the center of your healthcare experiences. They set up diagnostic procedures, devise treatment plans, guide you through care decisions. They prescribe medications, authorize hospital admissions, and refer you to other physicians and providers. In this episode of Consumerpedia, we'll talk about how to find good doctors and the best medical facilities near you, how to take charge of your medical care, and what Checkbook has learned by analyzing data on tens of thousands of doctors across the country. Checkbook's executive editor, Kevin Brassler, is here to walk us through the process. Hello, Kevin.
Hey, Herb.
So, a lot of the advice we give on this podcast deals with saving money and preventing headaches when you hire someone. But choosing a doctor or other healthcare provider can literally be a matter of life and death.
We write this over and over again. It's just so important to take charge of your own healthcare. Every single day, hundreds of patients in the U.S. die due to mistakes made in hospitals, either by the nursing staff or other medical staff, or by doctors doing surgeries, or just getting the wrong diagnoses. And a huge risk is surgery. We often write that hospitals are dangerous places. No one's really sure even how many deaths occur each year due to preventable medical errors, but even conservative estimates put it at about 200,000 a year, and there's reason to believe that number's a lot higher, as many as 400,000 deaths a year. So no matter which of those numbers is correct, it makes medical errors a leading cause of death in this country. It accounts for more deaths than either auto accidents or stroke. And that's just counting the deaths. There are easily 1 million of patients each year who are harmed from bad medical care and errors. And many of those injuries or infections, they affect patients, their quality of life. It's absolutely critical to choose the right doctors, to choose the right hospitals, so that first of all, you lower the odds of being the victim from a medical mistake. And then also to do other steps to protect yourself from the very real risk of being killed or harmed.
And you don't have to be a rocket scientist, or maybe I should say a brain surgeon, to realize there are big differences in quality from hospital to hospital and doctor to doctor.
Yeah, I think it's well known, among patients that some hospitals are far better than others in terms of providing quality care. But I don't think that many patients are aware that some hospitals with really good reputations often aren't doing very well in terms of making sure their patients are safe, preventing bad outcomes. What we do know is from hospital to hospital and doctor to doctor, we see just massively different outcomes. So, for example, we know that some surgeons are 4 times more likely to have bad outcomes. That includes deaths, complications, longer than usual hospital stays. And, when we're comparing them with other doctors for the exact same surgical procedures, even when we adjust for patient risk, that, some doctors may see more difficult patients than others. And even when we adjust for that, even at a specific hospital, we find that some surgeons are just far more likely to have bad outcomes than their peers. And across hospitals, the differences are even bigger. Doctors across different hospitals have massively different outcomes. Some are doing way better than others in terms of providing good quality care. These differences are not the result of some hospitals and some doctors getting more difficult cases. But when we control for that, we see these huge differences.
I have a pretty good relationship with the Medic One people out here in the Seattle area because of being a reporter. And I know from talking to them, if you have a stroke, there's one hospital you want to go to. And if you have a heart attack, there's another hospital you want to go to. They know that there is really a difference between facilities. And we have some great medical facilities in this area.
Another thing we see, though, is that some hospitals that have these really good reputations, the data don't back up those good reputations, that some of the surgeons in these hospitals aren't doing well at all. And so you do need to be careful. You can't just assume, oh, this hospital network or system has a great reputation for this, that I'll be okay. You really do have to ask strong questions. Unfortunately, there's just not a lot of good data out there that patients can use to make good decisions about which doctor to use.
So how do we find the best doctors and hospitals? Just ask around, hey, who do you have your hernia done by? You know, a good heart surgeon? I mean, that's not the way to do it.
Yeah, and that's actually what a lot of patients do, because absent any other information, what can you do? Unfortunately, it's just not easy to figure out which doctors are the best ones for your needs. At checkbook.org and in our magazine, we have some resources that can help. For primary care doctors, we have ratings from patients. For primary care doctors, that's really probably the best way to select a doctor, find out what other patients say about the practice, and especially try to find out, what lots of other people have said about the practice, not just one, sample of one, your friend or whatever. Mm-hmm. But, also to find out, does the doctor listen carefully? Does the doctor explain things thoroughly? Do they allow you to be an active participant in decision-making and coordinate well with specialists? I mean, these are the things that patients know about, and they're at the heart of good medical care, and patients can judge their own doctors pretty well on those fronts. And so the fact that we have patient ratings, at least for primary care, is a very good start.
And communication is so critical. You just mentioned that. I've had surgeons and doctors who are not the best communicators in the world. They don't have the best bedside manner, but they're really excellent doctors. But there are certain times I had a doctor who was treating me for a condition and just could not communicate with me. I fired the doctor. I just literally said, I need another doctor who can deal with me on this because I don't feel I'm getting the quality of care I should be getting. And I was really glad I did. The other doctor was so much better at communicating with me on these dosages and how I modify them and everything.
Yeah, it's just so key. I mean, it's important to find experts to diagnose what's wrong with you or to do the surgery and prescribe the right treatment plans. But, as you know, right, as you found out, as I have, as almost anyone who's needed medical care, especially specialty care, has found out, all that expertise doesn't do any good if the doctor can't communicate or chooses not to. And so, if the doctor's office staff is incompetent, you can't make appointments or get the, results from tests or get anything done, unfortunately, a lot of practices make it really difficult to get good care. We're speaking of specialty care. Checkbook also has some help for finding specialists. What we've done is we've surveyed other doctors in the area, and we asked them, if you needed care or a loved one needed specialty care from 40 different specialties, who would you recommend in each one of these specialties for care? It's called a reputational survey. In our reports, we pull the doctors who got the most mentions, and we actually report the number of mentions. That's important because it's important to be transparent. There's lots of these doctors lists flying around out there, and nobody's really sure how they compile them. We're pretty straightforward in how we do it. I do think that it's important to rely on, specialists, their reputations. That can tell you a lot about them, but you still have to find out, can they communicate well? Will they coordinate with others? Will they involve me in decision making? And so there's still more you're going to need to do to take charge of your healthcare.
A lot of people may not realize this, but Checkbook is a pioneer in reporting on surgeons. I mean, that's one of the first things we started doing.
Surgeons and also, in general, reporting ratings on hospitals and doctors. When we were founded in the mid-'70s, we began by evaluating healthcare providers. That was in the very first issue of Checkbook magazine in 1976. And no one was doing this back then. Nobody was reporting on patient ratings. No one was, reporting on hospital outcomes. No one was trying to evaluate medical care at all. And really, no one was doing what we do, even as late as, Y2K. And one of our latest projects was to take a look at these large billing claims data sets that are available from Medicare and use them to build this really complicated model that looked at outcomes for surgeons, whether patients lived or died, whether they had longer than usual hospital stays and things like that. Mm-hmm. And no one had done this nationally until we did it. And in fact, to be able to do it, we actually had to spend years suing the federal government to get it to release the data. We found in that analysis, as we mentioned at the top, huge differences in quality outcomes among surgeons for the exact same, set of patients, the exact same surgeries. We're working on a new analysis of surgeons, and hopefully we can improve upon even what we did before. So there's lots of data out there, but unfortunately, there's just very limited data that organizations like ours can tap into. I mean, there's tons of data being collected, but most of it's siloed, and it's not really easily accessed, or no one's going to share it at all to allow organizations like ours and other researchers, measure the performance of individual healthcare providers, in this case, especially surgeons.
So, how do you decide who will do your back surgery or replace your hip? We'll talk about that next. This is Consumerpedia, powered by Checkbook.org.
Checkbook.org can save you money on all sorts of services you need and help you find high-quality businesses in your area. From tax preparers and auto mechanics to electricians and plumbers, we have ratings in these 7 metro areas: Boston, Chicago, Philadelphia, Seattle, San Francisco, Minneapolis-St. Paul, and Washington, D.C. To find out more, visit checkbook.org. Our advice is always free. Ratings of local services are available with a subscription. If you live in one of these 7 areas and haven't joined Checkbook yet, check us out. Get a free 30-day subscription by going to checkbook.org/Consumerpedia.
Kevin, we live in a world of big data, so why can't we just go online and see how well doctors and hospitals perform in real life with various procedures?
Yeah, we've been fighting for years to get more data released, but unfortunately, major stakeholders like the federal government, state governments, large employers, health insurance plans, and others, they just haven't made informing patients a big priority. And in the meantime, people are dying because they don't know that a particular surgeon or hospital is prone to making mistakes. And what's really nuts is that within hospitals, most staff know which surgeons are great and which are not. And Herb, I've told you this story, and I've told many of my friends this story. My mother worked in a hospital as a chaplain for more than 20 years. And at that hospital, there were 3 general surgeons. And she saw firsthand that one of those surgeons was great, never had any complications, never had patients being readmitted due to problems after surgery, no deaths. And the other 2 were just absolutely terrible. She'd say, oh, the poor patients for these 2 other doctors, they always have some problem. Mm-hmm. And when my mom needed surgery, you can probably guess, right, which surgeon she insisted on doing it. And she made the medical staff add to her chart that only that doctor was allowed in her room or to touch her, and that the other 2 surgeons were not allowed to even enter her room. So I'm visiting with her at the hospital, and she and one of the nurses are joking around. The nurses are kind of kidding her about this instruction. And I say, so, who else here knows about these 2, as they call them, doctors of death? Oh. And they both say, oh, pretty much everyone. Maybe not the ER people because they just admit people, but all the medical surgical people do. It's not a big mystery. When patients for 2 out of the 3 surgeons are always having complications or need to be readmitted or dying due to problems. And I said, the nurses know it. Most of the medical staff knows it. Does the administration know it? And everyone in the room was like, oh, of course, they track infections. They track these problems. They have metrics. They know too. So, long story short, if you get rushed into that hospital and get admitted through the ER, right, you have some gallbladder problem or whatever, at the hospital where my mom used to work, you're going to get assigned to one of those 3 surgeons. Mm-hmm. So you have a 1 in 3 chance at that hospital of getting the quote-unquote good doctor. So just good luck. Patients aren't going to know that. This is why patients need information. Because the hospital, it has the information. The people working there know. And by and large, they're not even forcing these atrociously bad doctors to retrain or improve or do anything. And the patients don't know any of this.
I mean, you can't make a decision on which doctor is going to take care of you when you're rushed in the ER. It sounds like some of this falls back on the entire system that's not weeding out the bad doctors. They should be doing that for you. I don't care how much data you have. You're not going to decide which doctor's operating you when you're unconscious and wheeled in on a stretcher.
Yeah, you just get assigned to the doctor. I mean, you're basically putting all your trust in this medical system, this hospital system, and the doctors who are poor performing doctors aren't necessarily being forced to improve. And the reason is that doctors have a lot of power. Hospital administrators are mostly doctors. Another big problem is that it's really difficult work. People die during or right after surgery all the time. Even when the medical staff did everything correctly, surgery is inherently risky. But I mean, come on, we can do better than this. Patients need to know about these big differences in outcomes so that they can make better choices. They shouldn't just get stuck with the surgeons who don't know what they're doing or are sloppy in how they do it.
What about the pushback I hear all the time from doctors when this story comes up, that metrics by themselves don't tell the full story? I may be the doctor who gets the really difficult cases. We may be the hospital that gets, no one other hospital can treat them. We get them, so the outcomes are going to be different. Is there any truth to that the metrics may not tell the full story?
It's always the excuse that we get, right? That this doctor didn't perform well in this analysis because, well, I only take, the risky patients. I'm assigned the riskiest patients. Even when you control for risk, we see these massively big differences. And so it can't just be difficulty of cases. Even when you look at the same mix of patients, you see huge differences across hospitals and across physicians, across surgeons for the same procedures. And so there are huge differences from doctor to doctor. I don't think anybody could argue against that. I think what happens is that some of the low-performing surgeons argue that, well, I'm getting more difficult cases. I'd argue that no, that even when we control for that, there's still these big differences. But I don't think anybody can say that, massive differences from doctor to doctor exist just because of that some are getting more difficult cases than others. We're seeing these big differences in outcomes no matter what.
And what about the other side of the equation? Is there information available about individual hospitals?
So there is. So for hospitals, there's more data out there, but still there's so little info on individual doctors that's not really saying much, but there are some resources. One is called the Leapfrog Group. It's a nonprofit that works really hard and very effectively with its partners to push hospitals to improve their safety records. And it's just a great resource. It's really kind of making hospitals be more transparent about problems that they may have and making them improve, right? Making them commit to, it sounds like a wild idea, I know, right? Being careful and making sure that the patients stay safe. The Joint Commission also credits hospitals for certain types of care. For example, it might give a hospital recognition for doing knee and hip surgeries. These designations can help, especially if you're seeking specific types of care. And there's other resources out there on hospitals. The federal government has a site called Hospital Compare that looks at some different types of care and tries to rate them. I think it should be doing way more. But there is at least some information out there on the hospital level.
So is there anything you can do to help make an intelligent decision when it comes to your medical care? Kevin has the answer to that question for us straight ahead. You're listening to Consumerpedia, powered by Checkbook.org.
Consumerpedia Fast Facts. The term doctor comes from a Latin word meaning to teach, and it was first used about 700 years ago. About 1 million American doctors have active practices right now. It's one of the highest paid professions in the country. It's estimated that U.S. surgeons leave sponges and medical tools inside their patients between 4,500 and 6,000 times a year.
Kevin, taking charge of your medical care means more than just picking the right facility and picking the right doctor. It means being involved in the decisions that are being made, finding out the options as to how this condition is going to be treated, right?
Yeah, for most medical conditions, there's usually more than one treatment option. So it's really important that you learn about all the options and understand them and maybe the risks from them so that you can make the right choices for yourself. And if it's a relative that's getting care, maybe an elderly person, it's important that you learn about those treatment options also because you might need to help them make the decision for themselves. It's also vital, and this is really important, if you have a complicated medical problem or you've gotten a new diagnosis or somebody has recommended surgery to you or hospitalization even, to seek out second and maybe even third opinions about your case. I say this all the time, but getting additional opinions is probably the most effective yet underutilized tool in healthcare. So if you're told you need surgery, ask why. Ask the surgeon how many they do each year. Then this is an important issue. One thing we know about surgery is that practice makes perfect. And don't assume that the doctor to which your primary care doctor refers you to or to which you've been assigned through the ER is the best choice for you. You need to be ready to get other opinions and switch providers if things don't go well. When I had knee surgery about 15 years ago, I got 4 different opinions until I met with the surgeon that I decided was the right one for me, basically based on what he planned to do. The other surgeons planned to do a different procedure, and I just wasn't comfortable with what they were recommending.
And your insurance will pay for these other opinions. People don't realize that.
They will, and I think that even if they won't insist on them paying for it, the insurance companies are smart enough to know that the more opinions you get, the more likely it may be that you'll find a doctor who doesn't recommend really expensive surgery or other things, right? Instead of recommending back surgery, they might just recommend physical therapy. This happens all the time, that a lot of doctors, what they know if they're surgeons is surgery. They may not know about other treatment options that will work better for you or just may not recommend them because that's not what they do.
In a situation like this, I always ask my doctor, is there a less aggressive, is there something else we can do rather than go all the way to choice A? And in many cases, there are.
And what we know is that within different communities, studies have shown that, in certain cities or in certain towns, men with, say, prostate cancer, in some communities, like 75% of them had surgery. And in other communities, it was less than 25%. And so, the differences there, they're not based on the medical conditions of those patients. They're based on what the surgeons and doctors and the urologists in those towns recommend. And in some towns, they were just recommending surgery automatically because that's just what they do. And in other towns, they weren't. And what they found is that the outcome level in terms of surviving the prostate cancer was about the same. So why undergo surgery if you don't have to? A lot of times, doctors are recommending surgery or a type of surgery that other physicians might not recommend. So in the case of my knee, and the first 3 doctors I met with, they recommended replacing the ACL, grafting in a new one. The 4th surgeon I met with said, your muscles are strong, it's stable enough, you're going to need a knee replacement someday because you've done so much damage to the thing. Why go through a year-long rehab? We'll just fix up the meniscus and you'll be back playing basketball in 2 weeks. And that's what I did. It's been fine ever since.
But you were still terrible on the court, right?
Yeah, it didn't improve my level of play, but I'm back out there. And really the most important thing is the other doctors would have got me back out there, but it would have taken a year. Mm-hmm. This doctor got me back out there in a couple weeks. And it's been fine. Most people would say, well, it's kind of extreme to talk to 4 surgeons, but you know what? For me, I just wasn't getting the answers I was comfortable with in terms of even how the other doctors who wanted to do this graft were going to do the surgery. A big thing with surgeons is that they'll learn a certain way to do a procedure and then they just stick with that forever because that's the way they know how to do it. And then as improvements come along, they don't necessarily adopt the newer methods. That was true in the case of my knee surgery, for example. There are different ways to do the procedure. For me, an even better option was not having to do it at all.
I'd like to end with an important point. They went to medical school, we didn't, but we think by going on Google, we can find out everything we need to know. But indeed, you can find some information, bona fide information, if you go to the right sites. I like to use the CDC website, Medline Plus, that's from the National Institutes of Health, the Mayo Clinic website, the Cleveland Clinic website are really good places to just find out about the conditions, and it might explain to you what some of the options are. So you're just a little bit more informed when you have that discussion with a doctor about the alternatives.
The good news is that Dr. Google and all these sites, these wonderful resources out there, you name several, they can tell you anything you want to know. The problem is they might also tell you everything you don't want to know, right?
Yeah.
I mean, it's amazing how long my kids have survived, that they survived at all, given the different indicators we were Googling when we thought something might be wrong with them. But I do think that overall, it's better for patients to have a lot of information than not having any of it. And in the old days, we had to just rely on what doctors told us. And often I think patients themselves, they know what's wrong with them. They know something's not right. And they may go Google to try to find out what's not right and get the wrong information, but at least it's spurring them to act somehow and to learn about their condition. It's just vital that you do so, because once you've learned about your own condition, then it gives you even more power to decide, what's the best treatment plan for me. And in some cases, it may be that different treatment plans have different risks and you may have different preferences. And you need to communicate those preferences to your doctor and also to your family, because you need to make sure everyone's on the same page and on your side.
Really important information. Thank you, Kevin.
Thank you.
Kevin and the Checkbook team have written a series of in-depth articles that explain how to find the best primary care doctors, specialists, and surgeons, how to do your own medical research, and how to take charge of your medical care. Checkbook subscribers can access ratings for doctors in Boston, Chicago, Minneapolis-St. Paul, Philadelphia, San Francisco, Seattle, and Washington, D.C. Well, that's it for this episode of Consumerpedia. I'm Herb Weisbaum, the Consumer Man. Thank you for listening.
Consumerpedia is a public service of Checkbook.org. We're a unique nonprofit that empowers you, the consumer, to save money and make smarter choices. From auto repair shops to doctors, plumbers to vets, you can count on Checkbook.org to help you find the best services and avoid the worst. Local ratings are unbiased and accurate. If you live in or around these 7 cities and haven't joined Checkbook yet, check us out. Boston, Chicago, Philadelphia, Seattle, San Francisco, Minneapolis-St. Paul, and Washington, D.C. To get your free 30-day subscription, go to checkbook.org/Consumerpedia. Consumerpedia, empowering consumers to save money and make smarter choices.